Good afternoon, everyone. My name is Allison Northrup, and I'm Associate Director for Government Affairs at AMCHP. It's 2 o'clock. I'm going to try and get us started right on time. Welcome to our January 21st all-member National Policy Call and COVID-19 Town Hall. I am filling in for Amy Haddad this week, and it's been a while since I've been on one of these calls with all of you, so it's great to be back with you today. Just a few housekeeping reminders. All lines will be in listen-only mode. You'll be able to unmute during the Q&A. If you have a question for the presenters, you can also type it into the chat box. Please fill out the evaluation survey at the end of today's call. As a reminder, today's call will be recorded, and if you encounter any technical difficulties, please email Jess Cohen at jcohen@amchip.org. We're going to do a flip the script a bit on the agenda today due to some scheduling conflicts with a few of our presenters. We will start off with our state spotlight with New York's COVID-19 response activities. We'll next go to the MCHB update. I'll give the AMCHP policy update, and we'll close out with an update from CDC, and then have Q&A for AMCHP and CDC at the end of the call. If you have questions for New York and Dr. Warren with MCHB, be sure to type in the chat or unmute yourself at the end of their presentations. The rest of the Q&A you can save for the end of the call. So without further ado, and let me just make sure I've got my friends from New York on the line, I will turn things over to Lauren Tobias or Megan Carroll from the Division of Family Health and the New York State Department of Health.
Hi, Allison. Thanks so much. Can you hear me okay?
I can hear you great. Yep.
Awesome. And Lauren, I think, should be joining us. She might just be running a minute or two behind. So I can go ahead and get started. Basically, we're here today to talk. Oh, I see Lauren's joining right now. We're going to just give a quick update about some of the New York State response to COVID-19 as it relates to maternal health. And I see Lauren's here, so go for it, Lauren, if you want to. I think you're muted, though. You just want to unmute yourself.
Hi, everybody. Sorry I was late, and thanks, Megan, for starting. And you might need to jump in. I'm getting pulled a few different ways right now, as we all are. So thanks, everybody. So we were asked to do a brief update on the COVID-19 maternal task force that we had last spring, which feels like a really long time ago, as I'm sure it does to all of you as well. So why don't we just go to the next slide? So last spring, the chair of the governor's office, and I should back up by saying this, there was AMCHP had asked us to present on this. They had seen it they'd seen an update in a blog that was posted by NASHB. And basically last spring, the chair to the governor, secretary to the governor, Melissa DeRosa, convened a COVID-19 maternity task force. And this task force really included a broad range of perinatal health experts and advocates across New York State. The reason this was convened is, if you might remember, New York was kind of the epicenter of the pandemic, especially in the United States. And one of the consequences of that is that visitation at hospitals was, in fact, eliminated. And as a result, support people were being excluded from hospitals, which was really impacting people, pregnant people and laboring and birthing people. And there was a lot of concern about that and that impact on people. And then, and just in general, the impact COVID-19 was having on people who were pregnant. So this task force was really convened to look at what were some quick things that the state could do to better support pregnant and birthing people. And so the group met 3 times in April of 2020 and developed a set of recommendations, and were presented to the governor, and the governor accepted all recommendations. Next slide. So these were the recommendations that came out of the task force. The first was really to diversify birthing site options and support patient choice. At the time of last spring, a lot of people were afraid to deliver in the hospital. They were afraid of getting COVID and being exposed to COVID, and they were really looking for alternative birthing sites. New York, unfortunately, does not have a lot of midwifery birth centers at this time. We had a law that had passed that recognizes midwifery-led birthing centers, but at this point in time, we don't have any. And we didn't have a lot of physician led birth centers either. But there was a need to really diversify patient choice in birthing centers. And so the recommendation was to look at already approved providers, hospitals and or physician-led birthing centers, and allow for temporary emergency opening of expanding those services. And the state also released an application for midwifery-led birthing centers to use and to apply. The second recommendation was around that issue I talked about before about support people. It was really what actually I think drove a lot of attention to the impact COVID-19 was having on maternity care. And the governor had already signed an executive order that required laboring people to have a support person during labor and delivery and postpartum. But hospitals were interpreting that postpartum period differently. Some were really interpreting it pretty narrowly in terms of the immediate postpartum period just being that period of time in the delivery room after delivering, not for the full duration of the hospital stay. So the executive order was really clarified to assure that support people, a pregnant birthing person could have a support person with them throughout their whole time in the hospital, from admission all the way through discharge for that labor and delivery admission. It also, the group also talked a lot about the role of doulas, and that for a pregnant or birthing person who had a doula, that only allowing one support person really made them choose between a support person and their doula, when in fact the doula was really a big part of their care team, and that they were an essential part of the care team. So the executive order really clarified that a support person could stay the entire time, and that a doula could be, if they did have a doula, was an additional support person that they were entitled to have as part of their care team. The third issue, again, I have to stress this was last spring, so testing was very different last spring than it is today. We were, and there wasn't as much testing available. So the recommendation was to make sure that pregnant people were part of the priority group to get tested prior to delivery. The reason for that is that what we were seeing is that people were presenting to deliver with an unknown COVID status, and some people with COVID were not faring as well during labor and delivery. And we really wanted to make sure they had the right care in place to help support them during the labor and delivery, and also be able to respond to anything that might have emerged. We also were hearing a lot about unequitable access to testing, and we wanted to ensure that there was testing for people throughout the state, especially Black and Brown communities. Next slide. And then I think, as we all know, there are terrible racial disparities in health outcomes nationally. New York is no exception to that, clearly. And equity really was a topic of great conversation of this task force. Talked about the equity of access to testing, equity to access to support people, access to PPE for healthcare workers and providers that were serving at particularly Black and Brown communities. So equity really has come up quite a bit in all of our work, and COVID-19's impact on Black and Brown communities really shows us there are great disparities that we see, and the role of racism in our healthcare and our outcomes. So ensuring equity was really a big part of this. This is a large recommendation. I can't say we've achieved it by any stretch, but we're taking steps regularly to assure that there is more access to equity. It started with putting up more testing sites in communities of color. We're working right now on a messaging campaign. It's taken much longer to get out the door than we had wanted, but a messaging and education campaign that we're going to be launching to help people understand a little bit more about how to protect themselves from COVID, but also that, it's important to seek care and not avoid medical care. We hosted calls with home visiting programs. We talked to community health workers about this issue, and really we're talking about how to give them tools to better reach into their communities. And we had a call on COVID-19 and racial disparities with our New York State Perinatal Quality Collaborative, in which we had Dr. Creer Perry, part of that conversation, who's a national expert on birth equity, and really had these conversations with our healthcare providers. Megan, is there anything you all want to add on the equity? I should have asked you before. Anything you want to add that I missed?
No, I mean, I think the point about including community voice was important. And also we shared a lot of this feedback with our colleagues in epidemiology to make sure that this applied to testing sites and access and, addressing some of the specific barriers we heard from people. So it was a way to make sure, I think it was addressed throughout the whole system. So that was very important.
Yeah. And finally, last slide, we were asked to do a literature review, which last spring, sorry. So the 5th was that messaging and education campaign. That kind of is a cross-cutting recommendation. It really was part of the equity work we're trying to do. We did find a kind of an information gap in certain communities and other communities, understanding more about COVID, how to protect themselves from COVID, why it was still safe to go to a healthcare setting if people with COVID went there, why were people looking different? Why weren't they showing, why weren't they taking their mask off to smile and greet them and things like that? So we really are still focused on trying to improve messaging and education around this. And also there was a fleeing from healthcare and really wanting to rebuild trust with healthcare institutions, especially for prenatal care, childbirth, and things like that, and to really expand that. And then the 6th was, we were asked to do a literature review on COVID-19 and pregnancy, which I can tell you right now is outdated. But at the time, we did a very quick literature review that we shared with our experts through our regional perinatal centers, as well as national experts. And it was during the period of time in which we were simply trying to better understand the impact of COVID-19 on pregnancy. There was still a great deal of conversation about transmission to neonates, when and how and things like that. So we really needed to, we did that quickly. We did it with our partners at the School of Public Health and the Catalyst program, which is a HRSA supported center of excellence with our School of Public Health to really support this work through the Title V program. And we shared it across the state, and then we used it as part of the webinar on COVID-19 and maternal equity that I mentioned earlier that was hosted by Dr. Creer Perry. And we have posted it for a while. We were trying to keep it up to date, but I have to be honest, I don't think that has been able to be maintained as we've moved on to other other phases of this pandemic and how to be addressing it. So those were the recommendations. We've come a long way and really considering most of them implemented. As I said, we're really hoping this messaging campaign launches. It actually was taping this week, some of the media. So it's launching kind of as we speak. Next slide. I think that's it. So I have a few minutes for questions if there is any questions.
Great, and thank you so much, Lauren and Megan. I know that you're being pulled in a few directions today, so I appreciate you guys taking the time to share this information about New York's response. Folks, if you have questions, please feel free to drop them into the chat now or unmute your line, since Lauren and Megan are going to have to scoot in just a little bit here. So again, any questions that you have for Lauren and Megan, feel free to pop them into the chat.
Yeah. And I will thank you for putting us a little earlier in the agenda. I know you don't typically do that. We do appreciate it. I have been, tasked like others on other COVID and actually vaccines. Now I'm on to vaccines. So any questions?
Yeah, I put my question in the chat, but I don't know if you didn't see it, which is about vaccination during pregnancy and what is New York saying about that? What's your line at this point?
For people who are pregnant, they're entitled to get a vaccine. We encourage them. We follow the EUA guidance that we're encouraging them to talk to their healthcare provider, but that pregnant people are in fact able to consent for that vaccine.
Okay, thank you.
Yeah.
I see another question in the chat. Will the messaging include COVID vaccination as New York State moves towards phase 1B, 1C?
At this time, the messaging campaign that we're launching is really focused on COVID-19. It's a little broader even than COVID-19. It's really about keeping yourself safe and healthy, trusting your healthcare provider, explaining why they might look different with a mask and a shield or goggles, explaining that they're taking infection control procedures and things like that. So it's not really about the vaccine or even the disease itself. It's about, good public health messaging, keeping healthy and things like that. We have not talked about a vaccine campaign. I don't at this time. But there is a lot of information about vaccines, and we are working with our local health departments and our hospital hubs that are distributing vaccines and others, so that if someone shows up who's pregnant, who happens to be in 1A or 1B, that they are in fact able to get that vaccine. They are, as I said, encouraged to talk to their healthcare provider, but they can consent to it if they'd like to talk to a healthcare provider at the vaccine site to understand the risk and benefits. If they maybe didn't talk to anybody ahead of time, they can have that conversation there, but that's not mandatory. That's up to them, and then they can get the vaccine.
Great. I'm not seeing any other questions come into the chat, but if folks do, oh, I did see one just come in. Can physicians' offices implement or administer the vaccine? Is the question.
Well, I think, as all of you know, we have a supply shortage nationally on the amount of vaccines we all need. Technically, New York has over 1,200 providers that are registered to be vaccine providers, but they're not all able to receive the vaccine because we just don't have enough supply right now. Most of those vaccines are being distributed through our state hubs. We're working our way to 20. I can't remember exactly how many are open today, but by the end of the week, we'll have 20 open. And our local health department and the pharmacy program through the federal government is distributing vaccines. We have, as I said, more people registered into the system. Many of them are physicians, but at this time, there's not enough vaccine to kind of go around.
Thanks, Lauren. If other folks do end up having questions that they type in, I can be sure to follow up with Lauren and Megan so they get your questions and we can try and get answers back to you. But thank you guys so much. I'm just going to advance the slide because I think you provided your contact information.
Yes, absolutely.
So many thanks for joining us.
Oh, thank you so much. And I'm so sorry I have to jump, but thank you very much for inviting us to this call. And yeah, please let me know if there are other questions.
Great. Thank you.
And hang in there, everybody. You're doing great.
Next, we're going to have a presentation from Dr. Michael Warren, Associate Administrator for the Maternal and Child Health Bureau. He likewise is being pulled in many directions today, so we wanted to make sure that he could do his presentation next. As you can imagine, new administration, there's a lot going on. So without further ado, if Dr. Warren is ready, I will hand things over to you.
Thank you, Allison. Good to be able to join you all. Thank you, as always, for the opportunity. If we'll advance to the next slide, just wanted to share a few updates from the Bureau. We're going to start with the Title V Partnership Meeting Series. So you all know we typically have the in-person partnership meeting every fall. That did not happen for good reason last fall, but we take that obligation to further support the partnership and provide technical assistance. We take that very seriously. And so really appreciate the team in our Division of State and Community Health, as well as our partners at AMCHP, for thinking about how we do that in this virtual setting. So we've moved the partnership meeting to a virtual meeting series. It's going to be spread out over 4 dates. There'll be 90 minutes of meeting for each session. And these are really designed for state Title V directors, SHIN directors, other Title V staff at the state level, so family leaders, youth leaders, MCH EPIs, SSDI folks, Title V folks, adolescent health folks, folks that you might normally have brought to the partnership meeting, but also folks that you may have wanted to bring to the partnership meeting, but you didn't before because of travel or cost restrictions or whatever. So this may actually open up some opportunity for other people to be able to attend. Next slide, please. So just to give you a quick overview of the 4 sessions, the first will be a kickoff and talk about the Title V priorities for the next 5 years. The second one will talk about the role of Title V in COVID-19. The third will be looking at implementing Title V with our guiding principles. So those include evidence-based practice and family and youth engaged practice. So particularly as you're thinking about this next phase of your action plan and needs assessment cycle, how you implement that work with those MCH guiding principles is important. And then the last session will be on providing some context for implementing your state action plans in light of things that are going on at the national level. So the blueprint for change that's been worked on by our Division of Services for Children with Special Healthcare Needs, as well as the HHS maternal health plan. Those may give you some additional context as you're thinking about doing your state level work. So links will be coming out from AMCHP and through our MCHB listserv. If you've got questions, Erin Patton on our team can answer those for you and get you connected. But we really are excited about the opportunities for this virtual meeting series. Next slide, please. Wanted to give you a heads up on a few things. The first are opportunities that we fund, but that are administered by partners. And so one, it's always helpful for you to know that they're funded by the Bureau, but two, wanted to give you a heads up in case they might have gotten lost in your inbox and we wanted to make sure you're aware of them. And then the third is I'll tell you about a new funding opportunity that we just released about a week ago. So if we go to the next slide, we'll first talk about the Maternal Mortality Policy Academy. This is being run by MCHB, and this is a 2-year policy academy. We'll be able to support up to 8 states. The hope is that the state teams have representatives from Medicaid, from public health, and other stakeholders, but really the focus is to build capacity for states to be able to address maternal mortality among Medicaid-eligible pregnant and parenting women. So if you're interested in participating in that, you've got a little over a month left to apply. You see the link for additional information as well as the email for contact for more information there. The next slide similarly has the opportunity that's being run through AMCHP and ASTHO, the Promoting Innovation in State and Territorial MCH Policymaking, or PRISM, because we love our acronyms in the federal government, and our partners do as well. So PRISM is a 12-month learning community, again, about 5 to 8 state teams. And this is going to be really intensive TA and capacity building to support the work that you're doing to advance policy implementation. Some specific focus areas are looking at equity in terms of how we address substance misuse and addiction and mental health disorders in women, children, and families in the particular context of COVID-19. And again, there are thoughts on who we'd like to be on those teams. So state MCH folks, someone from your state health official's office, Medicaid, behavioral health, and local public health departments. So that application period closes actually next week, the 27th. And so if you want additional information about that or have questions, you can see the contact information that is listed here. And then if we'll go to the next slide, really excited that we have been able to release this Emerging Issues NOFO. So this released on the 8th. This is a new funding opportunity for the Bureau. And the goal is to help meet applicants where they are with various emerging public health issues. We recognize that oftentimes when things are emerging, if they're not particularly established, there may not be a dedicated funding line for them. And it sure would be nice to have some funding to build some basic capacity in data or informational systems and workforce development or strategic partnerships. And so the goal for this funding opportunity is to provide some small awards, so 6 awards of up to $250,000 And these are a one-year award, but really to allow applicants to address those issues that may be emerging. So this would be a great opportunity if there were issues that were identified as emerging themes in your 5-year needs assessment, or as your work in responding to the COVID-19 pandemic has progressed. If there are those items that are emerging, would encourage you to think about applying for this NOFO. This is the first time we've done this NOFO. This is our attempt to continue to be responsive. You've heard me talk about how do we skate to where the puck is going to be. So this is moving us a bit in that direction to try to be less reactive and more proactive. And so we would love your feedback as this NOFO is out and as it's implemented on ways that we can continue to support you all and your partners in addressing emerging issues for MCH populations. So I think that is it. Yep, that's just our standard slide there. If you've got other questions, happy to answer those. I don't see any pressing questions in the chat. But you all know we're absolutely happy to help anytime you have a question. Feel free to reach out to me or the staff in the Division of State and Community Health, your project officers. They're fantastic. They're great at getting you the resources you need, and we're happy to support you.
Great. Thank you so much, Dr. Warren. We so appreciate these updates and some really exciting new opportunities that states can consider applying to. So thank you for joining us. And we know that you also have to scoot to another meeting, so take care.
Thank you. Bye.
And I will now move us on to the AMCHP policy update. So obviously we have a new administration, and last week, now President Biden released a new plan, which is being called the American Rescue Plan. This is his proposal for the next round of COVID relief. The price tag, it's a $1.9 trillion proposal. And I want to emphasize that this is just his outline of what a subsequent COVID supplemental bill could look like, and that it's really up to Congress to then flesh that out and actually enact it. So I'm going to walk through a couple of the top line points that I thought would be of interest to folks on this call. But again, it's just a proposal at this point. It's not even in introduced legislation. So the plan proposes $20 billion for a national COVID-19 vaccination program, $50 billion to expand COVID-19 testing, funding 100,000 public health workers in the short term to focus on vaccine outreach and contact tracing, but this is also towards a long-term goal of building our public health capacity nationwide now and for the future. There's a summary of provisions related to addressing health disparities in COVID-19. It doesn't get into a ton of specifics at this point, but really emphasizes at the outset the disproportionate impact of COVID-19, particularly on communities of color, and that this plan would seek to address those disparities and inequities. It includes a proposal for $350 billion in emergency funding to state, local, and territorial governments. This has been a sticking point in previous COVID supplementals where Democrats are really pushing this and have stated it as a high priority, and Republicans have not been in support of including this funding. Now, of course, we have a new dynamic in the Senate. So we still have a Democratic controlled House, and we have a 50-50 split in the Senate with Vice President Harris, now the tie-breaking vote in the Senate. So Democrats now have an effective majority in the Senate as well as a majority in the House. In theory, they could pass legislation, some legislation with just 51 votes. But so far, indications from Democrats in the House and the Senate have been that they don't want to go that route with this COVID supplemental. They would rather try to achieve a bipartisan bill and not push it through at that 51 vote threshold. As far as timing, we're hearing that it could be late February or early March for this kind of legislation. It will take some time to actually pull together the legislation and obviously negotiate, but the starting point is to negotiate a bipartisan package for a next COVID supplemental. In terms of AMCHP's MCH priorities for a subsequent COVID supplemental, we'll be seeking emergency funding for Title V. A previous House version of a COVID supplemental included $500 million in emergency funding for Title V. So that's really our benchmark for what we would advocate for and are advocating for in a subsequent COVID supplemental. Additional funding for MCHB, home visiting, as well as additional funding for CDC's surveillance for emerging threats to mothers and babies program. Sort of to that point, I have a request for folks on this call, if you're willing. I know that many states have already shared on these calls how Title V has played a role in your COVID response, and I imagine that you've shared this information in other venues and formats. But I would be very interested in having you share either on this call, in the chat, unmuting your line, emailing me, or filling out a Google form that's just been populated in the chat regarding how you or your state or territory has utilized funding from Title V to respond to the pandemic, and how you or your state or territory could utilize additional funding from the block grant to respond to COVID. And my interest in this is really to educate policymakers and congressional staff about the role of Title V in COVID response efforts and additional ways that the block grant could support state and territorial efforts to respond to the pandemic, with a focus obviously on MCH. So this does not have to be a right now thing, but I wanted to put it out there. Again, feel free to message me directly, or you are welcome to share in the chat to panelists or to all attendees now if you would like. It can be bulleted, it doesn't have to be super formal, but I so appreciate this information. So historically, day one of a new presidential administration tends to be pretty busy with executive actions, and President Biden has been no different. I wanted to highlight, this will not be an exhaustive list of his day one and day two actually executive actions, but I wanted to bring your attention to a few things. He appointed a COVID-19 response coordinator. This person, Jeffrey Zients, reports directly to the president and is tasked with coordinating the overall federal response for COVID-19. The president asked Americans to wear masks for 100 days. This is being called the 100 Days Masking Challenge. There are some concerns about the legality of a federal mask mandate for all Americans. So this is more of a calling on and encouraging folks in the US to wear masks, obviously voluntarily. Where the administration has a bit more, has a legal hook, is with the federal workforce and with federal property. So one of the executive orders that was issued yesterday requires following of CDC best practices related to COVID-19 among the federal workforce and on federal property. So social distancing, mask wearing, and other CDC recommended practices. The president issued an executive order on advancing racial equity. It's linked on this slide. I think it would probably be of interest to many of you, so I'd encourage you to take a look at some point. As part of this executive order, President Biden revoked President Trump's executive order that had limited the ability of federal agencies, contractors, and grantees to hold diversity and inclusion training and other trainings and activities related to racial equity. So that executive order, it proactively is focused on advancing racial equity, and at the same time, it has revoked this previous executive order. That was one topic that AMCHP had included in its priorities document for the Biden administration. So we were very excited to see this particular executive order. And one other thing I wanted to note about it is a focus on data equity. And so there's a newly formed equitable data working group that's created as part of this executive order that will be focused on equity in understanding how federal programs impact populations based on a whole number of different categories, but in particular, in this case, related to race and ethnicity. And I know that climate change is kind of MCH adjacent, but it's a topic that has come up in different areas on previous calls, policy calls. So I did want to mention also that Biden signed a letter to re-enter the U.S. Into the Paris Climate Accords. A couple of key staff announcements. So an acting HHS secretary was named, Norris Cochran. He previously served as an acting HHS secretary during the Obama to Trump transition. There is a new CDC director. This is not a position that requires Senate confirmation. So Dr. Rochelle Walensky was sworn in, I believe, at like 12:01 p.m. Yesterday afternoon. So she is officially now our new CDC director. There are acting folks at HRSA, CMS, and FDA, civil servants, acting HRSA administrator Diana Espinosa, CMS Liz Richter, and FDA Janet Woodcock. Positions that require Senate confirmation are the HHS secretary, CMS administrator, and the FDA commissioner. And just a note, a preview of what is coming soon. So we are already swiftly moving into the appropriations season for fiscal year 2022, though we literally did just, you're right, finish. You're not just blanking that we finished FY21 appropriations less than a month ago on December 27th. Sometime in early February, we should see some form of a president's budget request for FY 2022. Oftentimes in the first year of a presidential administration, you'll see in early February what's called a skinny budget, so kind of more like top line numbers, but we should get something from the new administration in early February. Even prior to that, we will finalize AMCHP's appropriations ask for Title V for FY 2022. And around the same time, we will have our board approved 2021 federal policy agenda. I'm just wanted to take a quick look in the chat. I'll address, there are a couple questions that have come in, and I'll be sure to get to those after we have an update from CDC. So at this point, I will turn things over to our friends. Oh, let me advance at CDC. I see Dr. Remley, you've been able to join us, which I'm so thrilled about. So I will turn things over to you.
Hi, everyone. Can you hear me, Allison?
Yes.
Good, good. I apologize because I feel like I got to know all of you and then jumped into the response. And I've now spent more time in the response than in my role at the center. But what I would say to all of you is it's just great to be thinking about women and children. And one of the things I would encourage all of you to think about is with COVID and with the response and with everything that has happened to disrupt our society and in particular families, how do we get all of us to be thinking about during recovery how critically important it is to think about children and families and really helping families in those first few years of life to be able to make up for which was a very hard year for everyone. It has been a year since we activated our Emergency Operations Center for the COVID response. We've had over 8,000 staff deployed, over 5.4 million hours. And I would say thank you to each one of you because I'm sure there are millions of hours that are being put in all your various organizations. We've had over 1,500 people who've been deployed to states, localities, tribes, territories and new and different places every time every day rolls around whenever anybody needs help. You know, tragically, we continue to see the loss of life, but also I think we haven't even really addressed or talked about the impact in people's clinical care and physical disabilities that they will have long-term from this pandemic. So we'll have a many-year recovery for us to be going through. The vaccine, as we've just talked about earlier, is certainly one of many lights at the end of a tunnel, but maintaining non-pharmaceutical interventions such as mask wearing and social distancing is critical. It'll be critical for us even after we've been vaccinated for a period of time until we really understand what herd immunity will look like and when we will reach that. I know I heard some earlier questions about the COVID vaccine and pregnancy. I'm delighted to say that through the vSafe, which is how people register for text message information after they've been vaccinated, we've had over 1,000 healthcare workers who are pregnant already registered, and each one of them are asked if they'd like to be part of a registry to be able to follow their pregnancy and their babies after birth. So we'll be collecting a lot of very good information about the vaccine and its potential impact on moms and babies. I think importantly, the EUA included the ability to vaccinate pregnant women, and the American College of Obstetrics and Gynecology came out with recommendations that each OBGYN offer the vaccine to that pregnant woman and discuss the pros and cons. And we who again are taking the vaccine. General updates, you just mentioned, Allison, about Dr. Walensky joining us yesterday. She joined yesterday and she's already incredibly busy. And I would say she's an infectious disease doctor who has done, her life's work has been around not just the care of HIV patients, but making sure that all HIV patients have access to care and access to timely diagnosis. I'm happy to say her husband's a pediatric oncologist, so she'll have somebody whispering in her ear about the value of families and children all the time. We do have some more resources to tell you about. We have updated resources for pregnant people and new parents. So there's if you are pregnant, some public service announcements around breastfeeding that have been updated. There are new social media messages and graphics for partners. And I think I can see that Wendy greatly is putting all of this into the chat box for you all as we look. We've done more easy to read, simplified text, information in Braille, and a number of PSAs that use sign language. So there'll be a lot, and Wendy's going to keep giving you all that information. I would also say there's an upcoming partner call about engaging faith leaders to advance effective COVID-19 response, lessons learned through global, domestic, and collaborations. That will be January 25th from 3 to 4. If any of you would like to participate, I'm sure we can connect you up. And then lastly, we did release our annual report yesterday, and you can find that on our website. And I want to let you know that Dr. Dana Meany-Delman is going to join us in February to actually discuss pregnancy and vaccine, and she'll have data now. Then, you know, she'll have December, January, February. So 2 months worth of data of the number of women that are accessing the vaccine. So we won't have any, we'll have short-term outcomes, but nothing, you know, long-term then. But it's exciting that women are making those decisions with their doctors and having an informed conversation and discussion. And I will just stop where I started. I think for all of you as leaders in the maternal child health arena, it is going to be critically important as our country recovers, as we talk about, you know, our economy recovering, or all of us recovering, really putting front and center the importance of children, the importance of early intervention, and making sure that we can all partner together on that to make sure that our decision makers are engaged, involved, and understand that importance. And with that, Allison, I'll turn it back over to you and see if you have any questions or comments. Wendy's just going nonstop here in the chat box, so.
Yes, thank you to both of you. And thank you, Wendy, for plugging all of these great resources into the chat. I will advance our slide and see if folks have any questions for Dr. Remley about CDC's update or for myself. I did see one question come into the chat that's more generally about staff announcements in the new administration, any news about who the CMS administrator might be. I have not seen, it seems like, so I follow a lot of like Medicaid wonk people on Twitter, and everyone is asking this question. I personally haven't heard names floated at this point, but it was good to see the announcement yesterday of the acting CMS administrator and someone who has been with the agency, I think, since the 90s, yes, with the centers. So
Yeah,
if that, go ahead.
My understanding, because I'm saying the same thing, is that the Biden administration is clearly spending all of their energy and focus right now on making sure they have the right people on board for COVID-19 and give themselves some breathing rooms. I think, and I think, I can't remember where I heard President Biden say this, but to have the professionals who've been there across administrations, knowing that they will do a very good job manning the ship until they have an opportunity was very important to him.
Yeah, and we've seen that borne out in the selections for folks to fill the acting positions. Let's see, a question. Is there a CDC project on emerging threats to mothers and babies? Yes, I don't know if Dr. Remley, if you want to take that one.
Well, we've had a project on emerging threats to moms and babies, started with Zika, and then it has also incorporated opioid response and syphilis, and now also COVID will be brought into that too. So Wendy Rubin, again, who is the queen of copy and paste, has given you the link for the surveillance for emerging threats to moms and babies. I think it will be very interesting after COVID, thinking about, rather than doing this one disease at a time, how do we work with our partners to think about how we can continually do emerge, always looking, right? Because we tend to find, Zika we found after it was a threat rather than identifying it very early on. And how can we set up a surveillance program that will really look for all emerging threats rather than those that we've identified and then react to.
Thank you. Any other questions for Karen? I know you like to be called Karen and not Dr. Remley, but it always feels funny. For Karen or for myself, please feel free to unmute your line or go ahead and type them into the chat.
One thing I will say, and I didn't have time to get it for you guys, but I will, in April 2018 to April 2019 was named officially the Year of the Child. It was before there was HRSA or anybody else, but after World War I, it was obvious. It was the work of the suffragettes. It was the work of identifying that there were certain risks to children, whether it be malnutrition or clean water and all the other things. They declared it the Year of a Child, and the country really focused on children. And that's why I think we could have another Year of the Child post-COVID and really encourage all of our partners and all of the stakeholders to really focus on children as we come out the other end of this historic pandemic.
Great, thank you so much. I'm not seeing any other questions come in, so I'm just going to advance our slides here. Folks can continue to type in, but I'll just give a few reminders. So starting with our next call, which is February 4th, we will move from bi-weekly calls to once a month. And this is so that we're not overburdening folks' schedules while we have the Title V TA partnership meetings through April. So again, that next call will be Thursday, February 4th from 2 p.m. to 3 p.m. Eastern. Jess has just put the link to register in the chat. It's also linked to in the slides that you should have received via email. And you, the link will have changed. So previously you could have registered for several calls at once, but since we're switching to monthly calls, this will be a new link. So make sure that you don't forget. Make sure that you do register for this one. As Dr. Remley mentioned, we hope to have a guest speaker from CDC on that February 4th call, Dr. Dana Meany-Delman, who can talk about vaccines, the COVID-19 vaccine and pregnancy. And let's see, that is all I have for folks. I'm not seeing any other questions come into the chat, so I will let everyone go a few minutes early today. Thank you all for calling in. It was my pleasure to see your names on the attendee list, and look forward to seeing you on February 4th. Thanks.